Hi, good afternoon, everyone. I'm Dr. Wee, consultant psychiatrist in Island Hospital, Penang. Yeah. So, how are you all doing in these times of COVID-19 and MCO? Huh? Are you getting stressed out? Hmm? I hope none of you, like break down. Yeah. Today we're going to talk a bit on anxiety and depression, especially focus on this time of like COVID-19 period, the MCO times, the restrictions, we cannot do this and do that, how that affect our mental health. Yeah, yeah. Of course, I'm a psychiatrist. I focus on the mental health, but I mean, definitely physical health is important. For me, physical health and mental health are equally important. Yeah. We cannot just focus on the physical and forget about mental health, which is actually related. If you are overstressed or anxious or having depression, which actually your immune system will come down and then make you more vulnerable for infection, right? Make your body even weaker, right? So a lot of news or anxious conditions that we observe in this COVID-19 period, right? I think you also like come across news that uh, people wearing, multiple protection, multiple masks. Wearing the rain jacket to shopping. Some even like because like too scared about like this virus. Some disinfect the money that they brought back. Even if you hear the news in the Korea, there's one lady like putting the money into the oven and then make the money burn out and so on. Yeah. So a lot of anxious conditions that happen in this kind of like COVID-19 period. Yeah. But I didn't say that it's not no need like to be careful in this period. We all must be careful as well. We don't simply touch, we wash our hand, but not overdoing it. Because once you overdoing something, then the anxiety come in very severe, then it will affect your function, your social life, your occupational life. Yeah. So it's very important to be calm in fighting COVID-19 in this period. Yeah. Uh, I do like hear from my colleague that there is patients come to see, her in, having physical condition, having physical illness, come to see her in a very, very anxious situations. Yeah, walk into the clinic in a very shivering way. Yeah, but when the doctor want to examine her, she scared to be examined. In her mind is actually she worried that she get infected by COVID-19. Yeah. So this anxiety really make her like very difficult like to function. Yeah. Uh, but the sad thing is like when want to refer her like to see me, and then she start like to refuse, saying that I'm not crazy. Why I need like to see psychiatrist? That's the misunderstanding. That's a common misunderstanding in among the public. Seeing psychiatrist is doesn't mean that you have. I mean, you are crazy. No, no. Yeah. Anxiety, depression is a very common condition even before the time of COVID. Yeah. 20%, one out of five actually having anxiety or depression. Yeah? So this anxiety, depression is ranging, mild to severe, right? Yeah. Some people ask me, uh, is it like anxiety normal? Why need like to get treatment? Huh? Yes, anxiety can be normal reaction. Yeah, when we are in a very stressful situations, definitely we are anxious. Yeah, today we walk out because of if we need like to walk out to buy things or what, at the time of like COVID-19, then we are more anxious than usual. Yeah, that is expected. But if your function is still not yet disturbed, you can work, you can function at home. Your social life, I mean, with your family members are normal. You are not like easily irritable, angry. You can sleep well. Yeah? Then that you don't need treatment. That's what I mean by normal anxiety. But the anxiety become a disorder, anxiety disorder, when the function get disturbed. Not able like to work. For those who need like to work, of course, I mean in MCO, some people don't need like to work, right? I mean you are so lucky that you don't need to work, but I know that you are also anxious, right? Yeah, because I mean cannot work. Sometimes you need like to take pay cut, and then some people will lost job as well. Yeah, so all these situations, worried about infection, worried about economic situation, it make people like become more anxious. Yeah, but when we say that anxiety disorder means that the function is already disturbed. You're not able like to function as like before, right? Your social function for those students who are study, they cannot study. Yeah, then the function is badly disturbed, then need treatment. Need treatment. It's not that scary actually, like to get treatment. I mean, some another stigmatized things about like psychiatry would be like, if you go like to see doctor talk about like you need like to take antibiotic, you need like to take diabetic medication, hypertension. Usually people accept, but when talk about like psychiatry medication, uh, we'll go scared. I mean, a lot of side effect. The first thing in the mind. I mean, will destroy my kidney, will destroy my liver, which is actually not true. Which is actually not true. Of course, all medication have side effects, including the Panadol that you are taking. Yeah, have side effects. Yeah, but when doctors use medication, we are waiving the risk and benefit. I mean, about like the need of the medication, I would say. Yeah. But of course, I mean, in psychiatry, in mental health, treatment doesn't mean only medication. If your condition is not severe, I will say, why want to take medication, right? Okay, yeah. So if you have any question, you can like start like to type in your question if you want like to ask something. Yeah. Uh, if you are not yet having question, then I will start like to answer some of the question which is posed to me before the live. Yeah. Okay. So the first questions here is like, what is the difference between panic attack and anxiety attack? Okay. First thing we need like to understand here is like that there's no anxiety attack, but it's like anxiety. If we are talking about anxiety disorder is a big umbrella. Anxiety is a big umbrella which like consists of like a lot of different type of symptoms. Yeah. Panic attack is one of it. Panic attack is one of the symptoms that patient can experience when having anxiety disorder. Again, if you are like to ask anxiety disorder, there's a lot of different type of anxiety disorder as well. We are not going to go into like that detail. We understand here anxiety disorder is a big umbrella, which like having different kind of like symptoms. Panic attack is like the experience of like something like heart attack, or something like suddenly you can just imagine suddenly a tiger come in front of you. That kind of like panic condition is called panic attack. uh, Palpitation, shortness of breath, difficult to breathe, tremor, the cold extremities, all are symptoms of panic attack, and it's a very severe, which some of the patient can faint. Yeah? So that is called panic attack. It's one of the symptoms of anxiety disorder. Yeah? Uh, Other symptom of anxiety disorder besides panic attack will include over worried, excessive worried, yeah? Insomnia, cannot sleep, yeah? Poor sleep. Yeah? Those are symptoms of anxiety disorder. Yeah. Another common one is like pain here, pain there, a headache. Yeah. It's a common symptom of anxiety as well because of feeling tense. Okay. So now we go to the second questions. There's someone asked about like, should depression be treated with medicines, therapy, or both? Yeah. Okay. To answer this question, actually, it depends on the severity of the depression or even anxiety. And I answer it together. Yeah, whether it's anxiety or depression, it depends on the severity. in the severe condition, most studies show that combination of medication and psychotherapy is very important, very effective, yeah, to be done together, yeah. And then if you're talking about psychotherapy, the most effective or most studied show effective of type of psychotherapy will be cognitive behavior therapy, yeah, for the anxiety as well as depression. Yeah, how do I determine? I mean, what patient need combination, what patient need psychotherapy, what patient need only medication. A lot of factors we need like to consider. Just now I'm talking about severity. If severe patient, definitely combination. Yeah, but there is also patients who are not that severe but don't want to do any psychotherapy, because I mean not everyone can do psychotherapy. I mean it depends on the motivation of the patients. Yeah, so for those who just want to take medication, yes, I mean that is one form of treatment as well. Yeah, but many of the time the improvement cannot be like 100% if just use medications. Yeah, in terms of psychotherapy, just now talking about cognitive behavior therapy, which is like actually training the patient to be his own therapist, uh, learning the skill. So when we talk about learning the skill, if patient don't motivated enough like to practice every day, then for sure no improvement. And then the improvement we are talking about in doing psychotherapy is like actually months. Yeah? You can't see improvement inside 1 week. You can't see improvement in like few days. Not possible. That is also the reason why combination treatment will be needed, because medication work a bit faster. I will not say that very fast, but a bit faster than psychotherapy. Okay. Yeah. And then probably I use this question also like to answer a bit on the medication. Yeah. Uh, in terms of medication treatment, yeah, uh, why medication can help in anxiety and depression? Is there like some studies that like show that medication help? Uh, First of all, we need like to understand how medication come about. Medication come after people already have studies, scientists, doctors already like studies why the patient can get depression and anxiety, right? Which we need like to understand that when someone who have anxiety or depression, actually the chemical in the brain start like to be not normal or actually lower than expected, lower than normal. Yeah. So the medication can stabilize the neurotransmitter and the chemical inside the brain, and then that can help in the symptoms of the anxiety or depression. Yeah. What is a common problem or common questions asked here regarding medication? Usually people will concern is like medication is addictive. Is it all medication addictive? Yeah. Uh, Actually, addictive is just anxiolytic relax medication. Yeah. If you heard before, medication such as Xanax, medication such as lorazepam, midazolam, domicum, yeah, those will be like the medication which is addictive. Yeah, they have a very fast effect, but it's very addictive. Yeah? Addictive means that they will need more and more medication, more and more medication. Yeah, when they are dependent on the medication, right? Especially long use. If they use it for months, then they will start like to have higher and higher risk of addiction. Which I will say that if you need this medication more than 2 weeks, you need like to consider antidepressant. Yeah? Antidepressant is not addictive, yeah, but antidepressant take times to work. Yeah? Slightly faster than psychotherapy, but of course slower than those anxiolytic that I mentioned just now, those medication which is like immediate effect, right? Uh, I mean, of course, I mean, if you think that you need medication or you are not sure that you need medication or not, then it's better like to seek, I mean, psychiatrist advise whether your condition need treatment, need medication or not, or is it like some counseling or psychotherapy is good enough? Yeah. Mm. Okay. Now we go to third question. Could my depression be causing me physical pain? Like what I mentioned just now, pain is a very common symptom of depression, especially among Asian group. Studies showed that because in Caucasian group, usually it's easier for them to express their emotion. Yeah, I'm feeling sad. Yeah, but in Asian group, especially among what I noticed in my practice is among those elderly group, yeah, uh, they are not that easy like to express their emotion of like feeling sad. Yeah, but they come out of like complaining pain here, pain there. But all investigation done normal. They go to orthopedic, do X-ray here, do scan there. Uh, Everything is normal. But pain never subside. After pain, complain pain shoulder, then next time complain low back pain, and then jump from one side to another. But no, problem able like to be identified. Yeah, those are very common symptom of depression as well. Yeah? But one thing we need like to consider also, is it proportionate even if like patient have the physical illness? If the pain is like beyond, what something like if you get a small cut, the amount of pain that you experience is like something like a heart attack kind of pain. The pain is like more than what is expected. That one also is a possible showing that the patient is actually having depression. Yeah? So pain is definitely a symptom of depression. We go to fourth question here. Yeah, what kind of lifestyle changes will help with depression? Okay, we focus on this COVID-19 period. Many of the times that when someone get depressed, they are actually focusing too much or over focusing on the part that they don't have or they lost. Yeah, the financial that they lost, for example. Yeah, the things that they don't have. Yeah, they focus too much on that. Then that will cause depression to be worse. Yeah? Yeah. But I will say that the mindset need like to start like to change, to focus on what they have. Yeah, it cannot be like zero. You lost, but you still have some things that you're going to have, which you, if you can appreciate on what you have, then depression can be become like milder, can be okay. Yeah, you still have your family, you still have your loved one. Those kind of things. What it means like look around you, see what you still have, right? Yeah. If we are talking about MCO, yeah, MCO is like very stressful. You cannot go out, but at least you can go out like to buy food, right? Or even you can call food delivery, right? Yeah. So look at what you have. Although you cannot go out to buy, to yeah, you can go out to buy, but you cannot go out like to do too many things. But at least you can still like look at what you want, what you have. Focus on what you have. Yeah. Lifestyle changes. Exercise with I always like encourage my patient to exercise. You know what? How exercise help in depression? When you exercise, especially more than 20 minutes, then your brain will produce endorphin. Endorphin is a happy hormone. It's a natural happy hormone, which can help to soothe your mood, to improve your anxiety condition. Yeah. So exercise is definitely important. But of course, in the MCO, in some area, nowadays they already start like to allow, some of the exercise, but not all type of exercise. Group exercise still like not allowed. Right? But you can modify. You can modify on the exercise that you can do. Huh? You cannot go like to public place. If you cannot go like to public place of like a crowded place like for exercise, then you can do some exercise at home. Right? Even now you are allowed actually like to exercise near your living area, right? Outside your house a bit, you're allowed like to walk. Those who stay in a condominium can exercise outside as well, right? So food, yeah, other lifestyle food. I mean, need like to make sure that you have healthy food as well. Uh, Please don't feel like too scared like to get food until every day you take instant noodles. I think that's not healthy. Yeah, because when you didn't take care about this nutrition condition, slowly it will make your body become like weaker, as well as your mind, your mental health will be affected as well, right? So sleep, yeah, sleep is also very important. Yeah, I do hear some people that because of MCO, they no need for those who are, I don't know whether lucky or not lucky. Those who no need like to go to work, right? So they have a very disruptive lifestyle now, where they watch video, watch YouTube until very late night. Yeah, so they sacrifice on their sleep. Yeah, so all those, I mean, bad lifestyle actually will worsen depression, as well as causing more and more anxiety. Yeah. We go to the fifth questions. Fifth question here is like talking about, is depression more prevalent is in women than in men? Actually yes. Yeah. Most studies show that women is more having high prevalence of depression as well as anxiety compared to men. Yeah. A lot of different say postulations on the factors. Some people will say that endocrine, different and so on. Yeah, but the fact is, yes, I mean, it is women have like more depression and anxiety, which I will say a bit more than just endocrine problem, because the way women see things and men see things is a bit different usually, right? So those kind of personality of feminine kind of personality, yeah, will make them a bit more prone to get depression and anxiety. Yeah. Six questions. Okay. What is the most promising recent development to treat depression? Okay. Treatment of depression. I mean, I think the second question just now also like did ask about depression. Yeah. Treatment of depression. Treatment of depression's medication. Yeah. Psychotherapies, I mentioned the most proven psychotherapy will be like cognitive behavior therapy. Yeah. That is the most common type of treatment. Yeah. But in other form of treatment, it's a bit invasive. Yeah. But sometimes when the medication not working, psychotherapy cannot be done. If you heard about transcranial magnetic stimulation, uh, using magnetic field like to stimulate the brain, yeah, is also one type of treatment for depression. Electroconvulsive therapy. Oh, some people are very scared about like hearing electroconvulsive therapy. What is that? Electroconvulsive therapy is actually triggering seizures in the brain. Seizures are the something like epileptic kind of condition. Yeah. But in the electroconvulsive treatment, I mean, give anesthesia to the patient, and then patient actually in the something like go for operation. Those patients like go for operation, so they are actually not they are putting into like not conscious. Uh, the I mean anesthetist will make them, I mean, lost their, I mean, not conscious. Then psychiatrist will give the electric charges. Yeah. Uh, oh, there is a question here by Namata Namu. Yeah. I heard COVID-19 affect the brain. Can it affect the mood as well? Okay. I mean, not only COVID-19, but of course, I mean, the infection, whatever kind of infection, where it go into brain, then it can affect the brain. But please clarify. So far, I not yet really like, I mean, have something like a read through a very strong study say that COVID-19 can infect the brain. Yeah. COVID-19 is still like the main area is still like the lung. Yeah. But in general, I don't know, probably like I missed some reading. Probably there is some, I mean, studies show like COVID-19 can infect the brain. That one I'm not sure. Don't quote me. Yeah. But I give you a general answer. If infection go into the brain, yeah, it will affect not only emotion, yeah, mood will be affected, anxiety definitely can be there, cognition, memory, reflex, speech, all will be affected. Yeah. So definitely it is something possible if the infection go into the brain. Yeah. But please clarify, is it like COVID-19 can infect the brain? That one I cannot conclude. Yeah. Okay. So we go back to the previous things about like development of the treatment of depression. Okay, just now I talked about the new, I mean, it's not that new, but it's more invasive. Transcranial magnetic stimulation, electroconvulsive treatment. Yeah. There's also another new one is coming, I think very soon. If not because of the COVID-19, probably they're going to launch this medication faster. It's a ketamine based kind of like treatment, which I not yet know in detail, but it's a new treatment form. New treatment form, especially for those who have treatment resistance. Some patients who are not responding to the all those available treatment, then I mean this combination of the latest technology is important. Yeah. Okay. So question 7. Yeah. What are some of the signs of anxiety and depression that often get overlooked? I think this one is touched just now. Yeah. Usually, a pain will be like the symptom which is like overlooked. When someone like complaining pain in a multiple area, which is like changing from one to another, not consistent. Yeah. Then you need like to think also about like anxiety, depression. I do get some referral from my colleague, I mean from neurologists, even from for gastroenterologists, patients complaining about like the gastric pain. Yeah. But after treatment and treatment and treatment not improving. Yeah. But once we start like to check the patient, patient is actually having more than just gastric problem. Patient is having also anxiety, because we need like to understand that anxious patients also tends like to have gastric problem. So sometimes, I mean, it's not really gastric, I mean, illnesses. It's not really like the stomach have problem, but because of the anxiety is too high. Like what I said just now, pain here, pain there. I mean, sometimes pain in the condition that actually no pain. Yeah. Anxiety is common of like presenting like that. But please get me right. This is not something like patient pretending the symptom. No, no. Patient did not pretend the symptom. The symptom is true, but the cause is different. Sometimes the cause is not at the stomach, but the cause is anxiety. So the treatment need like to be correct in order like to improve the patient's overall condition. Yeah. Mm. Question number 8. What do I do if I think I am depressed? Okay. One thing is like depressions. Some patients can identify their own mood, feeling sad, depressed. Yeah. Some patients will need, I mean, will need someone else to tell them. I mean, their loved one, the people around them to observe, and then to tell them. Yeah. But I will say that if you think that you are having depressions, uh, better get assessment. Yeah, better see a doctor, get an assessment, understand about the, I mean, your condition. Is it that you just having some low mood or normal? I would say a normal sadness. Yeah. or is it you are already having a major depressive disorder, which need treatment? Yeah, because treatment still like it's better like to treat early. What happened if you didn't get treatment early? There is of course a possibility of the depressions subside by itself. Yeah, but the chance for it like to worsen will be higher. Yeah, those who are not treated, sometimes they just start with feeling sad, but after sometimes, when the sadness become more severe, then they will start like to having suicidal thought of not worth living, and it's very, sad if they really like do something like to end their life. So that is something that we need to prevent. uh, uh, and then besides that will be some patient will also like experience hallucination, hearing voices kind of thing is not the primary symptom of depression, but when the depression get worse, then they will start like to having hearing voices. They're going to lose control as well. Yeah. Mm. Okay. I see Puan Mia here asking question. Thank you, Puan Mia. Yeah? Doctor, I had depression. I consume escitalopram 10 milligram. I am a young mother, age 24. My daughter is 6 months old. What contraceptive should I use to avoid pregnant that won't affect my mood? Okay. Contraceptions. uh, Rarely contraceptions, will affect the mood directly actually. Yeah, although contraception usually, if you take the pill, is a estrogen progesterone kind of like pill, then hormone changes can make the mood swing in some patients, but not all patients. I will say that you need like to try first if you really want like to take the contraceptive pill. Yeah. uh, Other method which is like not related to the pill at all will be barrier type lah, which is like your spouse need like to something like using condom. Yeah. Then definitely will not have like any hormone kind of like changes, or even I do hear from my ONG colleague that intrauterine device, you can put intrauterine device. Yeah. Which is not hormone related. Yeah. Then the risk of like affecting the mood will be lower. Yeah. I think the best person like to answer this question will be gynae specialist. Yeah. Yeah. Regarding your escitalopram, and then I'm looking at that you are taking escitalopram, and then your baby is 6 months old. I'm not sure whether you are still breastfeeding or not. There is that is studies show that medication do express in the milk as well. Yeah. But the whether medications, if you are taking medication, whether you can breastfeed or not. Yeah. There's two school of thought. Yeah. uh, Although it's proven that escitalopram can be found in the breast milk. Yeah. But studies show that it is safe, because the amount go into the breast milk is very low. Yeah. So it is safe to breastfeed. Yeah. Not much problem on that. Yeah. But if you're concerned, then you, because your baby is already 6 months old, then if you can consider like to stop breastfeeding also. Yeah. Because the formula milk, of course, breast milk is better, but 6 months for the baby like to benefit from the breast milk, I will say is like not much. Yeah. So in that kind of condition, I will say it's okay like to change the breast milk like to formula milk. Yeah. Okay. You can consider that. Huh? Okay. Go back to the question here. Huh? Can you be depressed without knowing why? Okay. Actually can. Yeah. Especially those come from a strong, I say, family with strong history of depression. Yeah. In the family members that who have many family members in having depression. Yeah, or what some people call endogenous depression can happen. Yeah, so without a clear reason, actually, the depression can set in. Yeah, but always remember that when you have depression without a clear reason, one thing need to rule out will be medical condition. Yeah, that is also the reason why it is important to see a doctor to check when you having symptom of depression. Yeah, I personally do diagnose one patient with pancreatic cancer. Yeah, because that patient presented with depressive symptoms. Yeah, the intestinal symptom, the gastric symptom, the abdominal discomfort, not that severe. But what is like very, I mean, curious me will be like in this patient, no clear reason for the patient to get depressed. Yeah, so I do all the investigation. Uh, unfortunately found that the patient tumor marker for pancreatic cancer is high. Yeah, then I, of course, I refer to gastroenterologist for her tumor problem. Yeah. Yeah. But what I want to stress up here will be like, if you have depression or symptoms of depressions, no clear reason, then better investigate, better check clearly whether you have other medical condition or not. What is other causes of depression then besides, I mean, the medical condition will be medication. Need to be careful also. Some medication can make patient presented as, I mean, feeling like depressed. Yeah, hypertensive medications, beta blocker group. If you heard about like propanolol, atenolol, those medication. Yeah, uh, some patient taking those medication can get the symptom of depression. Steroid will be another medication which sometimes not, I would say commonly make the patient mood swing, including to the depression. Yeah. Uh, Besides medication, besides these medical illnesses, other causes include also substance abuse. Yeah? Those who use like to take alcohol, when they are withdrawal from alcohol, they get depression. And those who are taking illegal drug like ecstasy, those stimulating medications, when they are out of the stock, out of those medication stock, sorry, the substance stock, then quite commonly they will go into a very deep depression as well. Yeah. So those will be like the common causes that to look into. Yeah. Okay. Uh, Another question here will be like, can I get over it without therapy or medication? Yeah, like what I said just now, I mean, I did answer this before, is, I mean, some patient, especially on a mild depression, yeah, some patient can recover, yeah, but I will still advise like to play safe, maybe get yourself being monitored by professional, and then at least like can monitor your mood closely. If the mood is like not improving, uh, usually the times that I will give will be like 1 month. If the mood not improving in 1 month, then you better get advice faster. Or if your symptom is like getting severe from day to day, even the second week, you see that your symptom is like getting severe, then you better consult your doctor. Because as what I said, depression have a lot of complication. Can cause, I mean, if it's severe, it can cause suicidal, it can cause psychotic symptoms. Uh, Besides that, social complication is also quite common. Yeah? So some family, because of like don't want like to treat the depression, then they quarreling every day. Then not only affecting the husband and wife relationship, uh, children children will be neglected as well, right? Mm. So I think those will be like the things that we need like to really take care about on depression, anxiety. Yeah. Is there any other questions? Okay. If no more question, then I will just do some conclusion here. Yeah. Depression, anxiety, uh, is a condition that can be treated. Yeah. And then it depends a lot. It depends a lot on like how one person handle their stress. Yeah. If you can cope with the stress, it did not affect your social, occupational function or studies, yeah, then don't worry. Yeah? Don't worry. Yeah? Just continue observing, give more positive thought to yourself, yeah? Exercise, do all those healthy lifestyle. Usually it will be okay. Yeah? But if you notice that you start like to have disturbance in the social function, in the occupational function, relationships start like to get problem, yeah, then better get treatment faster. Yeah, it's not that scary. Is it like very scary to see me? It's not that scary to see a psychiatrist. Yeah, I never force treatment to my patient. We always negotiate. Yeah, we always negotiate, and then until like which kind of treatment that you think is suitable. There is some patient who totally don't want medication. First they come into my clinic, say that, doctor, I don't want medication, anything that you can do. Yeah, we can try psychotherapy. Yeah, although I say that combination treatment will be the best. Yeah, of course I explain the reason why. Yeah, but if you still insist don't want medication, psychotherapy will be another treatment choice. Yeah, why we want like to continue make ourselves suffering without treatment, if there is option. Yeah. Treatment, there's a variety of option, different type of treatment. Yeah. Yeah, but first thing is like, if you think you need you have problem, then better to consult doctor early. Yeah. With that, I thank you, yeah, for coming in like to see. Okay, bye bye.